at Maestas. Thank you
You're
for
welcome.
the time. We're really excited to talk to you. I'm very excited to talk to you. Are you ready?
Yes, I am.
Can you tell me a little bit about your background and who you are and where you came from?
Okay, how this all came to fruition.
Yes.
I grew up in Coachella.
Uh-huh.
Okay, so when I this was like developing a program of this nature was always part of my dream.
Mm-hmm.
So, and why? Because as a youth in Coachella, my parents were, my dad was a truck driver in the farms.
Mm-hmm.
So he was busy driving. And as an infant, I was afflicted by polio. So my first encounter with a healthcare system or lack of healthcare was my mom would have to travel from Coachella all the way to the city of Riverside to provide for my polio visits. And of course my dad had the car, so he had to drive. So we would come via Greyhound bus. So every 3 or 4 months I'd have to have the doctor, the orthopedic doctor check my foot. And that way, that's my insight into healthcare. I said, well, why can't there be something in Coachella? And of course there wasn't, because it wasn't a priority, because why is the county gonna worry about providing health services for primarily Chicanos, low-income Mexicans who are working in the fields and are probably not gonna be there too much. But anyway, that's my first insight. Then of course, we got politicized during the Chicano moratorium and Cesar Chavez, that all that upheaval, Brown Berets. So as a senior, because I was an outstanding wrestler, the guys from the community, the college guys, my friends that were at the local college at UCR, at College of the Desert, they decided, hey, LA's having school walkouts, let's do one in Coachella. And they approached me, and I said, well, I don't know, you guys are gonna, I'll help you. And then they picked like 4 of us leaders, because they knew that if I started yelling, all the kids would, I was kind of popular, so anyway, he said, okay, what are you 4 guys? We're gonna walk out at 9 a.m. and one of you need to pull the fire alarm. That will be the signal for everybody to leave the school. So my deceased friend Tony Infante did his duty, and at exactly 9 o'clock, the bell rang, and then we started directing everybody, let's walk out, we're leaving, and we did. We walked out, and we went all the way, walked like 3 miles to the Coachella Park. And of course, it was really cool, because as we were walking to the school, the Coachella Park, we were walking by the local schools. See, they had it planned so that we would create upheaval, which is beautiful, because as we walked, all of a sudden the little kids were joining us.
Amazing.
The middle school were joining us. So by the time we got to the park, there was kids. And the beautiful thing about it, it was so stunning that the police didn't know what to do. They weren't going to touch us. They weren't going to do anything. They just let us hang out at the park. And then the high school guys the college guys had speakers and all that. So that was my first entry into. That was September 16th, 1970.
Cool.
Yeah, that's when we had our school boycott. It was very successful, and of course, the next day, the administrators threatened to suspend us and all that, and we kind of like stood our ground. We said, well, I knew they weren't going to suspend me, because not to show off or anything. I was the best wrestler the high school had ever had, so they weren't about to suspend me. So I said, well, go ahead, cut us out of the sports. because they knew I'd probably go to the rival school, and my mom would pull me out and would go to. I wasn't going to stay there. I was going to wrestle. If I had to travel to Palm Springs High School, I was going to transfer. So of course, nothing ever happened. And that was the other entry into the activism part, which you need to do. Then, of course, I went to College of the Desert, partly because back in the 70s, when university tuition was free, and they were begging for brown people because none of the university had any. I got accepted to every college I applied.
Nice.
They were, please come, Berkeley being one of them. But my girlfriend talked me into, no, you, and she was younger, so she won. I stayed local in College of the Desert. And then I transferred into UC Riverside. And I chose UC Riverside because, not because I wanted to, but I chose because I wanted to be near. They didn't accept me because I cried and I begged and please take me. I said, I choose you guys. So first of all, I chose where I wanted to go.
Nice.
So I went to UCR and of course joined Mecha and all the clubs, and then again when we started noticing that when we would go to Mecha meetings and then would see our white friends over there at Berkeley, and they were, how did you get here? Oh, we flew. What the heck? We had to use our own cars. So then we said, okay, let's do this. Let's take over the student body. So a bunch of us ran, and then we won, and we controlled the pot of money, which was school money, and guess what? We were flying to Metro meetings now.
Awesome.
We were driving unicars to Metro meetings. So then we kind of like, well, that's how the power works. You don't have to necessarily be angry and beat people up. Just if you can, but don't sell out. I mean, yeah, you use what's available there. Don't take advantage of it. Don't misuse it. Don't be corrupt. But if it's something that's allowable, let's do it. So we did that, and then I ended up going to UCLA. I transferred to UCLA in 1973 for a graduate school.
How long were you at Riverside?
I was 73 to 75. I got my double major, and then I transferred to UCLA, and then of course that was grad school, and of course we, things didn't stop there. I mean, in fact, a lot of my friends from Coachella who were now graduating from Santa Barbara, San Diego, and all they ended up going to UCLA Law School. But I went to the School of Social Welfare. And of course, back then there was a height of activism. I mean, every other day we were taking over the chancellor's office. I always laugh when they have that picture of January 7th, or what is it, January 6th, where that guy's on Nancy Pelosi's desk. I said, damn, and he's an insurrection? What was I when I was putting my feet up on the chancellor's desk? Would I'd be in prison? Say, well, how life has changed.
Yeah.
But yeah, I remember that. I distinctly remember I would switch. Too bad there wasn't no Facebook. So all of us were taking turns sitting on the chancellor's desk and harassing him, calling him names and all kinds. And but while we were at UCLA, we were like, hey, let's go back to Coachella. Let's take over and do all this. And I said, yeah, sure. So the only problem is we were too young. So I got out of UCLA at 23. So who's going to hire back then? Let's go back to, well, even today, go back to 77, 78. who's going to hire a 24-year-old Chicano with an education? Seriously. Private industry? No. Maybe some government, but they're going to start us, at the social worker 1?
What kind of jobs were you looking for?
Well, I wanted to any job basically, but because of the market was kind of, it's who you know, and you know that term, who you know, and the rest of it. I ended up working for a nonprofit in Venice, and it was social work, doing stuff, but it wasn't. It was my way, of course. And while I was there, I was still active. And then back then there was a recruitment I'll still remember the first time the International Youth and Student Festival was held in the Western Hemisphere, and it was going to be held in Havana, Cuba. So, because I was active and I wasn't afraid, I said, heck, what are they going to do to me? I don't have a job anyway. And you know what? My mom and dad, if I have to go live with them and pick crops, big deal. I'll pick crops. So I signed up, and I went to the festival. And of course, back then, and like now, it was restricted. So we tricked the government. We flew into New York, got organized, and then we took a bus to Montreal, Canada. Yeah. And that's where we took the Air Cubana, and they picked us up and they took us to Havana. Yeah. So we couldn't travel from the United States to Cuba, so we found a way. We went through Canada. So then that's when you met people from all over the world. That was just crazy. I mean,
what year was that conference?
78.
78.
And of course we met the Comandante, we met Fidel and his brothers and everybody, Yasser Arafat, everybody was there. It was like, it's like the Olympics, they have an open ceremony. Every delegation walks in with their group, and there's a closing ceremony, and there's a big speech by Fidel Castro, one of those 4-hour gigs that he used to do when he was, I guess he was I'd say he was 50, so he was just firing out people, over 1 million people were there and all that. So after that...
what was it like meeting him?
Actually, I've met him a couple of times. The first time I met him at that festival, it was like one of the last days, and it was at the park, the Havana, the Lenin Park. So there was every country was there, except I think Israel and, I don't know, even South Korea was there. I think only Israel wasn't there. And not officially United States. We snuck in. So just Israel and U.S. weren't there, everybody else was there. No. But they had so it was a last day celebration, so at the park they had food, and every 5 feet I could swear there was a barrel of rum. So, and there was all these international music groups. I can't remember someone from U.S. It was a major band. But I was hanging around with a couple of guys from Chicago, one being Chuy Negrete. I think he taught at UC Berkeley. He was a doctorate in musicology. His name is Jesus Chuy Negrete. And he had his guitar in the back. And as we were walking around, having good drinking rum, Fidel sent one of his minders. I mean, that's what they are. Yeah. So the minder said, hey, Fidel quiere hablar con ustedes. Oh, okay. And he said, Fidel said, why aren't you guys going to perform? Tienes guitarra, porque no vas a tocar, va? Porque no nos invitaron. Oh, okay. So all of a sudden,
Wow.
the minders came and they took Chewy.
Yeah.
Chewy, they took him to the. It's one of those stages that comes out of the ground, like at Disneyland. You ever been to Disneyland?
Yeah.
So it was so cool. So we saw, oh, they're taking Chewy, all right. And it was cool because this rock and roll band was playing, and all of a sudden they disappeared, and boom, Chewy came up. It was like, wow, that's crazy. Yeah, so Chewy played for the whole world.
Amazing.
Yeah, it was amazing. It was incredible. Wow, that is crazy. But he approaches and he wanted.
Yeah.
He, of course, being the international mind that guy was, he knew everything about Chicanos. He knew everything about us, Aslan and all that stuff. So he just kind of like said, well, your U.S. organizers, I mean, obviously they're progressive whites, the Lawyers Guild, there wasn't, I mean, they're good people, but they're do-gooders. They're not interested in what we were there about. So anyway, then of course that was the main thing. I mean, it was a great meeting people from all over the world. I mean, it was, before you know it, I was speaking Italian, French. I speak Spanish. It's not that hard. I mean, at first you could understand, some of those words you're saying in French, I understand, but wow. Where no one slept. I mean, we're all just having a good time, and we're going to, every day there was events. So my highlight of the trip, we went to the Isla de Juventud. You've heard of Isla de Juventud, where it's run by children.
Yeah.
And they're into ecology, environment. I mean, they keep that island beautiful. I mean, it's the cleanest island in the world. I mean, if you look at the coral reef, the only coral reef left in the world is basically in that island.
Wow.
So that was spectacular. I mean, youth, I mean, I used to think 13, 14. Well, that's not international youth. International youth is like 30, 40. And I thought, wow, you mean I'm youth? Yeah. I think I was like 25 back then. So I said, I'm youth? Because I always thought you'd go and to college, everybody's 18, 19. Well, in the rest of the world, because you can go whenever you want to go to university, there was 40-year-olds, 50-year-olds there.
Amazing.
If you know how the rest of the world works, you get tired of working. Oh, I'm tired, I'm going to go to college. If you don't go by 18, you're settled, and it's hard to quit that low-income job you got and go back to college. So I learned that factor. But then I came back and I started working in Inland Empire. After that, I got hired by Dr. Armando Navarro, who had this, I don't know if you ever heard about him. Dr. Armando Navarro. He was a Chicano organizer, and he was very charismatic. He was among that I call one of the major guys. If you know Chicano history, there was Tejirina, Jose Angel Gutierrez, Corky Gonzalez, and I put Armando in that group. The other guys, the Cesar Chavez and the Dolores Huertas, they're really just owned by the Democratic Party. I mean, let's face it. I like them because my history with them, I worked with them. I worked on their campaigns. And at one time, we went in Coachella, once we get into this, in Coachella, I could call Dolores anytime. Dolores, ¿cómo estás? Everything good? Hey, we need you here. Can you come? Here comes her and 3 carloads full of farm workers. Now, Dolores, how are you? Can you come? Can you talk to my scheduling? Come on, Dolores. You know what that means, don't you? They're going to schedule you and tack on a $20,000 fee. No. Dolores, what happened to you? But you look at that transition. Because she was always, anytime you needed her. We needed her at UCLA, she was there. We needed her at UCR, there. Her and Caesar.
Yeah. When did you work with them on what campaign?
Proposition 14, the farm worker rights, the agriculture, where they, that's when I was at UCLA. That was in 75, 76. And anytime again, we could always depend on them to come. Later on, we had like we helped with the UCLA law student walkout when they had the strike, the Chicano students. So actually, it was ethnic groups, the blacks, Chicanos, and the two Indians that were there, Native Americans that were there. They all walked out. It was good, and of course, Dolores helped and all that. And then after that, after Hermano, then this started happening. This is our first entry.
What is this? Can you tell me that?
This is, I used to work at an agency which is pretty progressive. It was called the Inland County Health Service System. That was put together by, I believe, maybe Richard Nixon, because Richard Nixon, and then supported by Jimmy Carter. And their job there was to provide healthcare services in case of, nuclear war. So they wanted to make sure there was clinics and hospitals and beds and all that, because when you would look at a lot of agencies, like and still, this is a funny thing. We just went through a major epidemic, and you know how many hospitals were built? None. And we were in 78 right here. We were talking about we needed just in inland counties. I think we needed like 2,000 beds in 1978. The population has tripled, and we still we've added maybe 50 beds. So that was a hospital people, but they were in the committees too, so they wanted profit. Yeah, you will add beds, but you got to pay, even though it's not being used. We want whatever unused beds. Hey, that's a cost. And then on the other end, we were talking about community health centers, because that was, and we borrowed that idea from the Black Panthers in Oakland, because they were providing health care for kids back in the 60s. They were doing the free lunches back in the 60s. So they're the ones I always have given credit for starting this community health center movement.
Do you remember when you first heard about what they were doing?
Oh, well, when I was at the agency, probably in 79. Yes, whoa. And then, but right back then, they were giving Edward Kennedy the credit. He was the father of community health centers. Well, he was the father because he was helping get some funding. Always understand back now and still then, if you do a comprehensive study, if you need $1 million, guess what? They're going to give you $300,000. They're not going to fully fund you. So anyway, that's the Kennedy formula, and they always blame the Republicans. Oh, well, we were going to give you $100 million, but the Republicans. Yeah. Well, you
eventually
learn that's just the trick. How they pit each other and you lose. So we didn't have anything in Coachella. So this guy Ventura, he recruited me because I helped him get the funding for the health center in Coachella, and he knew I was from Coachella, and he came and asked me, Sam, can you be the director? I said, oh man, I'm over here doing fine. I'm in Dream World. I'm here with my friends at UCR, and you want me to go back to Coachella? And then he said, yeah. And then I finally got it out of him. Well, the grant is for $200,000 a year. And even back then, they couldn't find someone that would take the job for less than 40,000. So I said, well, how much are you going to give me, Ventura? How much? We can give you $15,000 a year. I'm making double. I mean, and he said, well, remember all these dreams we used to, because he went to UCR, so all these dreams about coming to Coachella and da. I said, wow, man, I can't eat my words. So, okay, I'll do it. I quit. And the thing back then, my parents lived in the valley, so I wouldn't have to pay rent. And I wasn't married, so I didn't have to feed anybody but myself. And I took the job. And for $15,000, but no building, nothing. Literally nada. So and they wanted, the government stipulated that we had to start providing services within a year. No building, no staff, nada. Fortunately, we had the Catholic Church. They were kind enough to give me a office building the size of that hallway right there.
Oh my gosh.
But hey, nothing.
Yeah.
And they did, I think they charged me $100 a month or something like that. So I took it, and that's when I brought in a good friend of mine that was an accountant, because in nonprofits, you need to know the financial laws more than anything else, because they'll trick you. If they want to mess you up, they'll mess you up. So I brought in Oscar Armijo. He's him and his wife Luisa, they're big. They're the ones who contribute scholarships to UC Berkeley.
Oh, wow.
Because their 4 kids went to Berkeley. The Armijos. I don't know if you... Yeah, there's 4 of them. I mean, they've been... Berkeley has given them awards and all that. The Oscar and Luisa, you can write them. Oscar and Luisa Armijo. You could find them and you'll see how prominent they are.
Well, what did they do? What were they?
Well, Oscar was my friend, my roommate, and he went to USC to learn accounting. I mean, one of the few Chicanos that back then that were even, because UCL was one of the top accounting schools in the country, right? And Oscar was my roommate, plus he was from Coachella. And he had recently moved to Coachella. And he, of course, back then, and his wife was a social worker. Back then, they weren't hiring us, so hiring brown people, the county. So Oscar, hey, come on. And Oscar, well, you know, and he was such a great, and he's still such a beautiful person. He didn't even care what I paid him, so I said, well, Oscar, I can only pay you what I get paid, $15,000. That's what you're gonna get. And you know, I didn't mind. I mean, he said, that's okay. My parents live down. I'll live with my parents. And he came in, and of course, that started the ball rolling, because he knew all the ins and outs of how to get money and all that. And of course, the big trick we used to do back then, we ourselves would pretend we were farm workers. So we'd go to these state healthcare meetings, and all these white guys back then, I mean, all these white guys were holding these hearings, and all of a sudden we'd rush into the meeting and start speaking Spanish. I say, oh, necesitamos servicios en los campesinos de Coachella, and the guys would just, what? Sí, necesitamos dinero. And they'd freak out. No, you guys don't speak English? No hablamos inglés, pero necesitamos servicios para los niños, para las embarazadas. And then all of a sudden they'd find somebody they'd give us a contact. They'd find some Mexicanita who worked in the health department somewhere in the state, and they'd contact us. And all of a sudden, well, the committee heard you. They really don't understand what you're saying, but they're willing to give you, $20,000.
Wow.
Okay, I'll take $20,000. 30,000, 50,000.
Yeah.
So that was the funny part, how we would.
How did you come up with that idea to?
Because we always used to have this, well, remember we used to always take on the chancellors and all those guys, and we already had the tactics that, well, part of it came from Jose, you ever heard of Jose Angel Gutierrez?
Sounds familiar.
Yeah, he wrote I don't have the book. He wrote a book called the How to Handle Mexicans. How the white man handles Mexicans. Where is it? And part of his tactic was, because he was in Texas when they took over, I'll find it somewhere.
Yeah.
He took over Crystal City in Texas. And one of their tactics was speaking Spanish. And we said, let's do the same thing.
Oh, wow.
Because then you go into the powers thing, right? If you're using their language, that they're going to win, because that's their first language. Our language was not necessarily English, because we went to low-income school. They didn't teach you proper English.
Mm-hmm, mm-hmm.
So we said, well, we can't beat them English to English. They're just going to rip us apart, and they're going to send us to committees, and they're going to drown us out like they do now. No, so we're going to do Spanish, and we're going to tell them we're farm workers, and they're not going to try to say, oh, find out where that Sam Maestas works so we could fire him. No, they thought I was a farm worker, because their image, that's what I look like. I'm a farm worker.
Mm-hmm.
So that's how we started getting state money. And that was some of the tricks. But then we move on to getting a building. If you remember, grew up in Coachella. I was everybody knew me because I was always in the newspaper as a wrestler. So there was a guy who had a clinic. He owned a big building, Dr. Macias. And he had just, like usually in most, back then, a lot of Medi-Cal fraud. Well, Dr. Macias got caught up in a Medi-Cal fraud scheme. Mm-hmm. So he had to sell.
Oh.
And it was a huge building. I mean, I approached him. Dr. Macias, I hear you didn't put it up for sale. He said, I hear you're going to sell a building. I said, yes, I'm leaving town. I'm going to. He had a huge mansion in Escondido and a huge, half of the polo ground where the Coachella Fest, he owned most of that.
Oh, wow.
Yeah. Yeah, he said, I haven't told anybody, but yeah, I'll sell it to you. And I gave him the spill and all that. I'm going to take your patients anywhere. Because even the corrupt doctors care about their patients. Because they want to feel good that they didn't abandon. There's always, they have this problem with abandonment. So I said, I'll take all your patients. They'll be mine. I'm not going to prescribe him uppers because he had the scam was diet. So he had all the ladies on diet pills, which was amphetamines, right? So that's why they caught him, because he was just amphetamines. So I'm going to take all your patients. I'll take care of them. Don't worry. Give me your medical records and I'll transfer. And that's all he wanted. And I think I bought the building for like $90,000, and the federal government, I wrote him a letter. I need a building, and if you want me to open up and provide services within a year, I need a building, and you got to give me the money. So they approved me using the $90,000 out of the $200,000 to buy the building.
What with the $200,000? What was that?
That's the initial grant. That's
okay.
That's what they were going to give me. And that was a clincher. Now I needed to hire a doctor. Then we had to hire a doctor on that. That was a clincher because the doctor I was going to hire, of course, where do I have it? He was a retired doctor, a white doctor. I'll find it later for you.
Yeah, no.
His name was Dr. Otis Coombs. I mean, you can't get whiter than Otis Coombs coming to Coachella where it's 99%. And he was an OD, not a family doctor. But he was willing to take, I think I paid him $30,000 a year. Because he was retired. He was an old guy. He'd say, I have a condo in Palm Springs. I want to do something. So I said, well, come and work. And he gave me his life. And as an administrator, I was the founding executive director. If he would have given me a false medical degree, I wouldn't have known what the hell that was. So I trusted him.
Yeah.
And he came, and the first day he said, Sam, all you have is babies and pregnant women. I don't know much about that.
Oh, wow.
And they said, and then he said, it's funny, I mean, I hope it doesn't sound sexist, but he said, look at my hands. And he had arthritis, so obviously he couldn't do a lot of gynecology. So, but that was great because then that gave me the in, well, I need a female doctor.
Okay.
But you weren't going to get a female doctor for $30,000. So I said, wait a minute. I had studied around in nurse practitioners. So I was lucky, and I got a disgruntled nurse practitioner from the county, OBGYN, because the counties treat the nurses like crap. At least back then they did. I'm sure they still do. So her name was Eve Bolin. And she was our first nurse practitioner, and like boom, I didn't realize this, but our patients, a lot of them knew Eve Bolin from the county because she was a nurse practitioner. So the word came out, Eve Bolin's at El Progreso.
Oh, wow.
And boom, the practice built up so fast.
Who were the primary people coming to the clinic at the beginning?
Farm workers. Mainly farm workers, just poor people. We really didn't care. I was I'm not gonna say you can't come to my clinic.
Yeah.
So a lot of people I knew, that my mom knew, my dad knew, all of them were coming. And plus, I got that money from the state. They gave me like 50 grand. So I hired like 3 community outreach workers. And I bought a van, and their job was just to go bring patients, pass out leaflets, go door to door. And that's their job. And all of a sudden we're getting all these people coming in. It was practically free. I think we based our cost on a sliding fee scale. Yeah. And back then it was like $5.
Wow.
All you had to pay, if you could afford it, because even $5, I mean, $5 is a lot of money.
But before this, you didn't have any experience in running a clinic. So where did this come from? Where did these ideas?
Well, just because I was an activist, I knew how you have to hit all the components, just hit everybody. And you're going to see, I had a lot of politicians that we hated each other, but when it came to working for a solution, we worked together. I mean, that's why you're gonna see a lot of, well, that's a right-wing Republican. He needs me and I need him, and the community needs him. I'm not gonna support him, but his job, and the trick with them is they always wanna feel good. So this is our congressman right here. You would call him right-wing, but the way you work these guys, these politicians, is you always work on their ego. So I would say, my catalyst congressman, because he'd call us socialists and all that, socialism, communism, all that. Obviously, so is public education that you support. Everything's communism. So I would tell him, you know what's sad about it, about our situation here in Coachella? Just in Northern California, those politicians, the clinic like mine, they're getting 10 times more money than I am. And they brag about it. And you can't do anything for our community? Mm-hmm. While these guys are getting, the money's there. Mm-hmm. All you have to do is ask for it. Why is it okay for the guy from Watsonville? Why is he advocating for his clinic and getting the money that should be coming here? Because we're more needy. Mm-hmm. And of course, the ego would work and say, "Well, I will help, but I need to be able to come anytime I want, unannounced." I said, "Sure, it's in the bylaws. The state corporation says you can never deny a reporter, a journalist, or any people that want to see your program. And you don't have courtesy." I say, "Well, courtesy is you let me know so I could be there, so I can walk you through, because otherwise you're just going to look like a dummy right there standing around, because the nurses are working, the doctors are working, they can't. So the only guide you have is me." So he relented on the unannounced thing. But I said, "Anytime you want to come, just let me know. Mm-hmm. You know, or I'll get a board member to come and walk you around." So I said, "Okay." And then obviously you see his picture. Now he's attending that communist function.
Congressman Al McCandless.
Yeah. So here he is at a communist clinic.
And you had people from the Mexican
Yes,
consulate.
yes. Oh, yeah. Everybody would. All of a sudden, once you got everybody wants to come. We had the Chinese delegations come by, and they came to my clinic because they heard I had I was automating. I was one of the first clinics, I guess, in the world that was automating our medical records.
Wow.
And they sent a group of people to see how we were doing. Here.
Mm-hmm.
That's it.
Wow.
Yeah, so they want to see what we're doing. And obviously, being polite as they are, they invited me to go to China, which I accepted. Mm-hmm. So
cool.
The next year I went to China with a delegation because they invited other people. So no, I went to Russia, I went to Mexico, Cuba, all over on health delegations. And but anyway, that's the thing of how you had to do with politicians. You just stroke their ego, because that's all they I mean, obviously they want you to give them money under the table. Mm-hmm. I wasn't going to do that. Mm-hmm. And we went on. After that, we did our clinic. It got real expensive. And then dental care. Mm-hmm. Now, dental care the dentists are the most conservative group of people to deal with. They right away hit me on the communist thing. That's social. You're taking our patient. I said, "Hey, can you afford to pay for them?" So the deal was fine. Look, you let me open my clinic, and I'll send you the specialty care. And of course, money.
Yeah.
So anyway, as soon as I'm only going to do general practice, but if they need braces and all that, I'll send them. I'm not going to do it. I have to send them somewhere, and I'll send them to you. And so they relented. They said, "Okay." They send me a big old official letter. And then they send it to the Department of Health Services and the federal. We're okaying the clinic to have dentists. And that, again, that's a different stroke. So then we had dental, and then I said, "Oh, shoots, where am I going to get the money for equipment?" So I called my guy, and I had heard that Indian Health Services, they give him everything. And I said, "Hey, Carlos," his name was Carlos Reyna. "Hey, Carlos Reyna, can you check something for me? I need some dental chairs and some compressors. Can you check for me?" And he said, well, I don't know, Sam. Everybody, who would can you check the Indian Health Services? He said, oh, that's right. We give them everything. So he said, then he gave me a call a day later, and he said, Sam, the Navajo Nation has a bunch of dental chairs.
Oh, wow.
If you can go pick them up, they're willing to give them to you. And they were in boxes. So I rented, Oscar and I and another friend, we rented a U-Haul, and we went to Navajo Nation, and they gave us, 4 dental chairs.
Wow.
With the compressors and everything. So all I had to hire a local community guy to hook up though. And we were in business. And good thing about dentals is there's less restriction. Mm-hmm. With Medi-Cal, you have every little square inch has to be in perfect place. Dental, I could have opened a dental office right there in that corner. I don't care. So no restrictions, just I said, damn it. I hired a local Chicano guy that I don't know if he hooked up these machines. It looks like it's working. It looks bad. Nobody had to approve it. Mm-hmm. So it worked. So that's how we started our dental clinic. Mm-hmm. And by then, everybody needed dental. Mm-hmm. The kids and the farm workers, they needed dental care. So we got that service going, and the main thing again with our gente, our poor people, is the older ones especially, where our teeth were all rotten. So unfortunately, they needed a lot of tooth being pulled. I mean, you can't salvage it. So we were able to salvage. So the kids worked well because by then we, as a association, the National Association of Community Health Centers, we were successful in adding dental care or preventative dental care into the CHIP program, the Comprehensive Health Care for Children, and that included dental care. So what was the plan? I went to all the school boards, locals, Indio, Coachella Unified, Indio, Desert Sands, and the Palm Springs, went up in front of the school boards, and of course, I'm going to do dental care, health care, physicals, sports physicals for all your kids, and guess what? It's going to be free. And what do you think they said? Well, where do we sign? So of course we did memorandum of agreement. So all of a sudden we had every kid coming for dental and physicals. Wow. And being a sports guy and remembering when I had the typical sports. The sports physical was turn your head and cough. I said, oh, sure, we could do that. That's it. So, and then we'll build CHIPS. What is it? The Comprehensive Child Care Act. They were paying for that. So I think it was like they were giving me $50 per visit, but if the kids needed more, because some of the kids needed more than just a health physical, they were all. Yeah. So we could build CHDP as a comprehensive visit. So all of a sudden, the guy didn't just need more. He needed more than just turn your head and cough. He needed a whole physical. So, boom! I taught the doctors how to do the right thing, because see, they thought the doctor, oh, well, you're low income, I'll just mark 5-minute visit. I said, were you there for 5 minutes? No, I was there for 20. Okay, if you just were there for 5 minutes, check this box. Yeah. If you're there 30 minutes, check this box. You don't just arbitrarily check anything, because time is money. I mean, if you're doing no tricks. I'm not here talking to you to do a 30-minute when you actually only did 5. No, you don't do that. We do not cheat. But if you're there with 30 minutes, don't you think I should bill for your time? You know, and then they would say, "Oh yeah." Then when it comes for evaluation, he's going to have to pay me more because you spend more time with the patient, you know, which is okay. So so then we were getting you know, all these kids from all these school districts coming to get the physicals. I mean, we're talking about hundreds. And of course, then I needed more staff, of course. So I hooked into the Natural Health Service Corps, where they would give you nutritionists, dentists, doctors, nurse practitioners. Free, if you know, back then, if you committed to work in a low-income community as a doctor, and when you graduated, you'd have to work at a clinic, 1 year, 2 years, depending how much your loan was. So I got in there and I said, you know what? I need doctors. I need nurse practitioners. What do you got? I need dentists. So, you know, I had to put a beautiful package that Coachella was. I turned Coachella into Palm Springs.
Yeah.
So all the doctors wanted to come to practice in Palm Springs, just 20 miles away from Palm Springs. And then all kinds of doctors wanted to come and work for me.
Were there any struggles with? Did they speak Spanish? Was that
okay?
difficult?
Well, this is another key. Okay, most of the doctors, if I have it somewhere here, most of the doctors were Spanish speaking. They were mostly Spanish speaking, and I would make sure of that. But the other thing, remember the cornerstone that I want you to also remember. Just because they were doctors didn't mean they were a line out there waiting because you were a Latino doctor, a Chicano doctor. They were being discriminated upon too.
In what way?
Well, they weren't hiring them. You know, they didn't have enough experience. And if you want to look at that, if you want to look at it if you want to look at it in that sense, they weren't. I mean, they were just getting out of medical school. They were just getting out of medical school, so I had a choice. I could get this wealthy European white doctor who I know is there just to write off his loan, or I could get a Chicano, African American, or Asian to come and work, and then would even screen them because they take God pills too. So I had to make sure, okay, this guy has to fit because some of them, especially the dentists, oh man, they just wanted to, they wanted to come on their terms. I want to only see 10 patients a day and da-da-da and da-da-da. And I said, no, we're going to see your schedule. We're going to put somebody in there to fill, because we have a lot of need. And I had to fire a couple of dentists because they didn't want to. And but most of them did. But most of them, yes, they spoke Spanish. They were Latinos. I had like 6 Latino doctors, 1 Asian, and like 4 or 5 nurse practitioners or physician assistants, and all of them spoke Spanish. Mainly women. So my staff was always diverse, and not because I wanted it diverse. It's just that because that's how it worked out. Because basically the bottom line is you need to speak Spanish, because all my nurses speak Spanish, but I can't have. I never liked translation, because you're asking a nurse that really is not well trained in the subject matter And you're using terminology that if they're literally translating what you said, they might make a mistake, and I can't afford that.
Mm-hmm.
So I'd rather have you speak Spanish.
Yeah.
And I lucked out. I got most of them. So most of our staff was Spanish speaking, dental, and then we became. Then the other thing was the community. We had a community survey, and they wanted eye services, optometry. So I said, how am I going to get optometry? Because no clinics, even today, maybe one or two have optometry services. And we're talking about 86, 87, in a migrant area. So being in that valley, one of the most prominent doctors in the valley was a guy by the name of Dr. Carrion, Dr. Reynaldo Carrion, who was an ophthalmologist. And we were friends for a long time. But the thing is politics kind of like would keep us apart. He was like a staunch Republican, Texas doctor. He's a Texan Mexican. He spoke Spanish. But he was, back then, just like now, you need to survive, you have to be with your colleagues. So I approached him and I said, hey, can you, I want to, the people in our community, again, they do love people, patients, right? So I said, our community, and he was proud Mexicano, proud Tejano, I said, our gente want optometry services. They do? Yeah, they picked it #1. And that he said, well, you know what? I'm good friends with the president of the Southern California School of Optometry. And I can talk to him and we'll meet and he could send you students. And of course he knew the guy because he owned half of Indio, Dr. Carrion. So the president of the school was getting thousands of dollars from Dr. Carrion because he graduated from that school. Oh, wow. So you think he was going to say no to Dr. Carrion? No, Sam, what do you need? Anything? So we had to do a study to prove that there was a need in the Coachella Valley for optometry. So we hit the schools. We were doing CHDPs already. We were already examining kids. So we started doing eye vision tests, and we found obviously low-income kids are going to have all kinds of vision problems. So I wrote a grant to the department of the federal government, and obviously they wrote back and said, well, they don't have money. And then, I know the trick. I just call it a demonstration program.
What's that?
Well, you're going to demonstrate there's a need.
Oh, okay.
It's just, terminology that these guys, that you need to bring these guys on board and all that. So they weren't just going to give me money. I had to prove I needed the money. So the doctor started bringing in the president of the school. He started sending his kids, and the only thing was how he said, well, can you help on the housing? Well, how many kids are you going to be bringing? He said, I can bring you 5. 5 for 2 days every week. And I said, oh, shoots. Housing. Oh, not a problem, because I had a friend that was in real estate. And he said, hey, we rent condominiums in Indian Palms Country Club. And I could get you a good deal on one of the homes. So how much? I think it was like $300 a week or something like that. Wow. To get 5 optometrist students to come, that's a deal. Yeah. So I signed a deal, and the optometrist student loved it because they would come and see the kids. Yeah. party, obviously, in Palm Springs, found us, and then they had a place to stay.
So you paid for the housing?
Yeah.
They didn't get paid? It was
No, they were
volunteered.
students, they were
Okay.
volunteers, but they had a place to stay.
Yeah.
And optometry, if you know about optometry students, they're not poor. I mean, there was like, they weren't poor, put it that
Okay,
way.
okay.
But they weren't brown either. I never got a brown one.
Really?
They just, a lot of women, optometrists, a lot of male.
But no.
But no, I couldn't get. But we didn't need it because they were doing students, and the students speak English.
Okay.
So then they came in, and then I did a demonstration project and submitted it to the government, and they decided they were gonna fund me, my clinic, and one more in the United States. So the demonstration was 2 clinics. So then they gave me money to buy the equipment, and I opened up the dental clinic.
Well,
And it was the funniest thing because I was getting a lot of patients, right? But they weren't coming for the exams. They were coming because I liked Ray-Bans. I mean, it was a big rage back then in the 80s. Everybody was wearing. If you were anybody, you needed to wear Ray-Bans.
yeah.
So we had a big Ray-Ban market. Everybody was coming. And I mean, we were seeing kids, but the majority, like the school teachers were coming and everybody wanted to be cool. Mm-hmm. So I was selling a lot of Ray-Ban.
Oh.
And Ray-Bans are not cheap.
Yeah.
But when you buy them in bulk, you're getting a good deal.
Yeah.
Because I mean, everybody wanted aviators, like those glasses that Biden wears, those aviators. Oh man, everybody. And so it was cool because even the farm workers were buying so you'd go to the fields and you'd see the farm workers with fancy. Yeah, because I was giving them cheap. I mean, whatever it was, they couldn't get a better deal.
Yeah.
Because we weren't there to make money. We were there to provide services.
Yeah.
So then the optometry, we became one of 2.
When did the optometry?
That started in 1987.
87. In the dental clinic?
83.
83, 87.
Yeah.
What was it like expanding the clinic? What were the challenges, the successes that you guys had?
I mean, it was all about providing healthcare services, okay? And then, because finding the patients that they were there, you just have to make them feel welcome. Like Pius' mom, I mean, she was undocumented, and we recruited her. She came in and loved the clinic, I mean. And, but I had to also, a lot of times, the patients want to come, but they don't have transportation and a bus route. Our one time a day and all that. So of course I would go talk to our, like our county board of supervisors, right wing of course, but it didn't matter. They're there for their patients anyway. So she made arrangements so that we could have more buses going to Mecca and more, and they put a bus stop bench in the clinic. Instead of it was at a city hall and they'd have to walk. Pregnant women walking at 110 degrees. So I said, no, we can't do that. Put a park bench. And they did. She did. Wow. Because she was a woman, she knew the perils of being a pregnant woman walking in 120 degrees. So they did that. And the other way, if the patients can't come to you, you go to them. So I started a mobile clinic. So we would go to the fields and provide services to the farm workers with our nice fancy mobile clinics. And of course then we found out, well, you know what, it's just not farm workers that need health care. So we found dilapidated housing up there in Cathedral City where the domestic workers, the house cleaning ladies and the gardeners and all them that serve the Palm Spring area. So I'd have to take I think we would weekly go up there and take care of with our mobile clinics. It was mobile clinic. We just outfitted RVs, converted it took out the beds and we serve. That's how we serve them.
When did you first launch the mobile clinic?
The mobile clinics, I would say 86.
Okay.
86. And they're real successful. And like I say, the only thing we couldn't do because the schools didn't have is my eventual thing was to put medical clinics in the schools. But at that time, they didn't have buildings, office to open. Because medical, remember I tell you, the state requires you X amount of inches per, and we would have to outfit a whole room and get the state approved. So we didn't. It was easier just to buy an RV and fit it and drive it to the schools. And we had one going almost every day at one of the schools. There was yeah, it was one heck of an operation.
Yeah, right.
But just skipping, what we had is a huge community outreach. I mean, we did drug awareness. At the schools would go and give things to the kids to, drug awareness for the parents. There was this sliding rule thing that we used to buy, so that the parents would know if their kids were using drugs. The signs and all that. Give thousands of those away. That helped the parents, and our community health workers would go there. So that's how we did the community outreach. We did the sports physicals. We did the CHDP physicals. The optometry physical. We were doing everything. And the coolest part is because we were doing it correctly, we weren't stepping on anyone's foot. But keep in mind, then the hospitals got wise. And guess what did they do? I mean, they didn't oppose us, they used us. And what they were doing, the local hospitals, I'll never forget, I'm talking to the administrator. When that emergency room would fill up, they would give on their own. They didn't ask me permission, but they made these little appointment cards. And it said, if you need health care now, you can go to El Progreso del Desierto Health Center.
Wow.
In other words, I had to wait a minute. First of all, we're a community health center. You're the last resort of health, not me, the county. Why aren't you sending them to the county? Because obviously the county wasn't going to see them. And you're responsible for that. Yeah. And he said, yeah, but I can't. There's too many. I said, well, if you're going to send them to me, we're going to have to do a memorandum of understanding. So when I need you, and I needed them because my moms had to get, they had to give birth. Yeah. So, well, you're going to have to give me something so that when my moms are going to deliver, you're not going to break the bank, because I used to pay for deliveries.
Oh, wow.
And they relented, You have to confront them, and they'll come up with a solution. So I got more than, I said, God, that is unbelievable. They're going to let me practically free deliveries. I mean, I think I was paying $200 per delivery. Wow. I mean, but again, and it was okay that they were sending all those patients, because at that time, like in '89, I don't know if you ever heard of the program, the federally funded healthcare program, which I don't know if you know how it works, but you add all your costs. So I had optometry, administration, mental health, medical, optometry, hospital. It came to and I didn't cheat. The other ones really cheat. I mean, I'd have to call these guys. I mean, I was able to do all that service, community service, everything for like, I think my federal qualified health care reimbursement was like, I want to say like 150 per patient. Some of these guys in Oakland and San Francisco, in LA, they were charging the federal government $500 a patient.
Wow.
I said, come on. I know what you're doing. Don't do it. But, money's money.
Yeah.
And, they had all these congressmen that were going to support him anyway. So I said, just leave me alone. So we went 150, which is good. I mean, consider that I started with a $200,000 grant.
I was just gonna say that's a pretty big,
Oh, well, that just blew up. It just blew up everything.
Yeah.
We could have everything, and I had scientifically already figured out that, because I figured out all the system. I figured out that every patient I saw basically was costing me $28 per visit. I mean, you come in my room, that's $28, but I was getting 150.
Wow.
So add in the other costs. I mean, maybe if I added everything that patient was getting, because they were getting X-ray, they were getting lab, they were getting pharmacy for $28.
That's wild.
Yeah.
Yeah.
Yeah, it's incredible.
Yeah.
So, but the other ones were doing less, and they were charging $500. And that's why nowadays, remember I started at 15,000. Executives now get maybe close to $1 million. They don't do crap. That's just robbery. That's why I call them poverty pimps. You don't deserve $1 million a year or 500,000, whatever you get. Because I ran the clinics. They're not that. I mean, you do have to hire competent people. But that's what you do anyway. Sometimes they don't because it's easier to buy off people. But that's another thing. But our major accomplishment was the amnesty program, the IRCA 1986.
What was that?
Okay. When the Ronald Reagan gave undocumented workers the path to citizenship, all you have to do is pass a test and get an AIDS test and a tuberculosis test. And this is our greatest accomplishment because of all the clinics and private doctors in California, El Progreso was the only clinic that the INS authorized to provide those physicals.
Wow.
And we were only charging $30.
Well, why were you the only one?
Because fortunately, we had a pretty good relationship with the INS guy. He was a really good guy, and he liked us, and he was genuine. And I had heard that that one of the stipulations was you have to have an AIDS test and you have to have a lab and tuberculosis. And I asked my friend from the INS, and sadly he died of cancer. One a really good guy. I asked him, well, you know what? Can you find out how we can become certified? Because the INS certifying doctors, the INS doesn't know nothing about medical. Why are they giving them this power? Because they don't know about medical, so they were real strict on trying to hire people. Nobody wants to do all that extra work. They just wanted to make the money. And plus I was going to charge $30. These guys, I guess, wanted to charge $300-400. So I have that one. I'm going to show you a lot of stuff
How long were you director for?
Oh, I was director for 11 years.
11 years.
Oh, and we'll get later on to what happened.
Okay. I'm sort of curious though, because you were director from the very beginning.
I was a founding director.
You were a founding director. Were there any other founding directors?
No.
Any other one?
No, I
any
did
other
all
founding
this stuff.
Members
I was.
You were the only one.
We'll get into that later. But anyway, we were the only ones. So it was really amazing because it opened my eyes because we're getting huge lines. And it was affecting me doing my other services. Because remember, keep in mind, I had to do labs. That's not cheap. I had to do tuberculosis. And you know, if you're from Latino countries, they do the, everybody was turning red.
Yeah.
But you know, we knew why, because they had the virus. So, you know, I had to talk to the IRS, you know, and then they verified, oh yeah, well, they're going to turn red, but it takes a couple of days and then they don't have tuberculosis. But the funny part about it is it just opened my eyes because I was coming to the clinic. I eventually had to open a special amnesty clinic in India.
Oh, wow.
So I remember coming to the clinic one day and I saw all these Mercedes-Benz, Rolls Royces. I said, what the hell's going on here? I knew it was amnesty day. We had a block where we would do the amnesty. Well, what happened, and it opened my eyes, guess what? A lot of those wealthy people, they just overstay their visas. And now they were going to get amnesty, and where were they going to go? They had to come all the way to Coachella, from LA, from San Diego, from San Francisco. So I had opened my eyes because simply minded, I thought only farm workers need amnesty. They're the only ones crossing. No, well, Sam, they're overstaying visas. And that's why I was seeing all these cars and the good thing, some were really kind because they said, can I donate, because $30, I know you guys are paying, it's costing more than $30, because I guess some of them were doctors themselves that needed amnesty. So it was really cool because we set up a little jar where they could donate.
Oh,
because
cool.
it's a net $30 is not. They were volunteering and say, let me give you extra money. Can I do extra stuff for you? So, and I'll show you some of the stuff. We did in a month, 15,000 amnesty physicals.
Wow. 15,000.
Yeah. And finally that induced the federal government to want to partner with us. Oh, shoot, I better be part of that. We want to look good.
Yeah.
So they gave me, I don't know, maybe $500,000 or something. Wow. But that's because I saw 15,000. You know how much they gave the clinics in San Francisco area, in San Francisco, San Jose, and they did nothing? They gave them $500,000 too.
Oh, man.
And I would say to my fellow directors, how many amnesty physicals have you done? Well, we haven't done none because we're not certified. And how much did the federal government? Well, they gave us $500,000, but we have to show that we're seeing. And then I said, really? So obviously a lot of them, the trick is you get the money, then you cry, and then they let you transfer the money to another program.
Okay.
So they still do that. I mean, all those tricks are still. I mean, I remember one of the major tricks that I learned real early is the government, let's say 3 months left to go in the year, and the government's the advisors would call around looking for money. Hey Sam, you got any extra money? Yeah, well, I mean, I got 50,000 that I'm not going to use, but I'm going to use it. I said, oh, okay. And then I'd find 3 days later, I'd get a letter. we're taking $50,000 out of your grant.
Oh, yeah.
What?
Yeah.
Well, you said you didn't need it. I didn't say that. Well, you said you had enough. And then I found out that where did that money go? The big clinics in San Francisco, Oakland, LA, San Diego. You're giving them millions upon millions, and you're taking money from my poor little project. And then, of course, next year when they called, Sam, how much money? I don't got nothing. In fact, I need. Okay, then hang up. I need more money. So you learn the tools of the trade. You try to be honest, and you get jammed. So the other stuff we would do, another big community event we did what was called Navidad en el Barrio. There was a program out of LA, out of one of the TV stations, and they selected our community, my clinic, to be recipients of food baskets in Christmas. So they would send us like every year that I was there, like 500 baskets, just give it to our patients.
Amazing.
So obviously everybody wanted to get into that. So it was easy. I didn't even have to do anything. I just tell my community workers, go to the schools, have the school aides that don't have nothing to do to find. I have 500 baskets. I need 500 names family names by a week or two. And obviously here comes thousands of names of people that needed baskets.
Yeah.
And obviously 500 wasn't going to be enough, so I would have to supplement it. So I would talk to the local businesses, the hospitals, and the Marines. I mean, I had the Toys for Tot. I mean, it's a trip how it works, but they don't. If they see you're doing something good, they don't care. So I even had the Marine bringing all these toys. I had some guy from North Shore. He was a toy maker. He enjoyed me. Here's a picture of all the food.
Oh, wow. Oh, wow.
So we were always, obviously you could see we were always in the newspaper. So that's so some guy, old guy, elderly guy from North Shore, which is up there by Salton Sea, he loved to make wooden toys, but he didn't know who to give them to. And he read one of our articles and he said, can I participate in your program?
That's so cool.
And he gave bunch of wooden toys. And obviously, sadly, a lot of our patients, wooden toy. Oh, I want a Nintendo. Wooden toy. But anyway, the guy that was from his heart. So we gave him an award and all that when we gave award, because he came on his own. We gave Toys for Tot. I mean, some people would say, well, that were Marines, Back then, I don't know if I'd do it today, but back then, they just wanted to participate. So we had the hospitals, the Chamber of Commerce, everybody was donating to us. So usually it'd be like 2,000 families. Remember, Navidad en el Barrio would only give me 5, so I'd have to supplement. So all these guys would contribute. So
that's amazing.
And then, so that, of course, we got popular. Parents, well, what else are you going to give me? So then I said, okay, well, our other big community contribution was we had a 5K, 10K run.
Cool.
And because of everything, we kind of like, look, well, everything cool is happening in affluent communities. Well, we got runners. We got our schools winning CIF championships.
Yeah.
I'll just bus all the kids. We'll just tell the coaches, bus them all, and we'll give them free T-shirts, free food, free water bottles, and of course, the first race we got like 1,000, and by the 6th race we were getting international people from all over the world coming to our 5K, 10K.
Cool.
So that again was a way to to bring in programs to our. And then the other cool thing we did is I got this idea, from the more affluent communities, because they would invite me to all kinds of other things. So one program that I keen and I really liked it is they would do present like movies, like premiere movies.
Oh yeah.
And so I said, well, heck, we can premiere movies too. So the first movie we premiered was La Bamba.
Nice.
So we went to the theater. They were gonna. I talked to them and said, "Oh yeah, sure, we'll let you have.
Cool.
I'm gonna pack it. I mean, they're not. I was gonna pack it. I was gonna That's where I got judges, community leaders, doctors, everybody to come. And then back then, so it was in the mall. So of course they were gonna charge. I don't know. They basically gave it free because they were gonna get free publicity too. And bless their heart. I don't know if you ever heard of the Red Onion. It was a nightclub. They had like food. It was a nightclub, real popular in the 80s. And they were adjacent to the movie theater. So I went to my friend who ran the Red Onion, and he said, "Oh yeah, bring all your guys. So we'll give the free, what do you call it? That free food?
Like a buffet?
Happy hour, yes.
Yeah.
He's gonna have a happy hour. I said, well, I'll buy the drinks. And he said, yeah, all open bar, and
Cool.
he charged me X amount of dollars. I charged $50 to these wealthy people who came. And we premiered La Bamba.
Nice.
Yep. And then we liked it, and then it was real successful. So the other community event we had was, what was it called, that movie with Jaime Escalante about the math, I got it, about where they were saying Chicanos don't know anything about math and low scores. It was with Jaime Escalante, Stand and Deliver.
Stand and Deliver.
So everybody, since we premiered La Bamba, now everybody, as soon as I hit the wave with Stand and Deliver, everybody.
It sounds like the clinic had a huge impact.
broad base.
Do you have any stories from like the early days about the impact that the clinic had on families or specific, cases of,
Well, remember every service we needed was based on community need, right? Because Coachella, the Coachella Valley was like a critically medically underserved community. I mean, we didn't have any. It was kind of like skewed, because if you look at the Coachella Valley, that's including Palm Desert, Palm Springs, and they have a lot of doctors. But they were most geared towards elderlies. You take them out of the factor, when you're factoring, because it was like a 30-mile radius. Well, guess what? Within a 30-mile radius is a Palm Springs Eisenhower Clinic, some of the most advanced hospitals in the world. But that doesn't. They could have the most limousines in the world. How about that farm worker family? They're not going to get nothing. So you'd have to tell the federal government, you know what, we're not going to include Palm Springs in our studies. We're going to. They're affluent. They don't. But the rule said with a 30-mile radius. So we had to like move it way out to the services out there, to all the way to North Shore where it was 30. So we, from North Shore all the way to Indio, that was our catchment area.
Yeah.
But that doesn't mean people in Palm Springs, because Palm Springs, they were poor. Remember we found that in Cathedral City. We found that dilapidated house, that trailer park. They can't have. You could have. They work at Eisenhower Medical Center, but they weren't serviced there, so they weren't going to get any service. So it was up to us. So I had to like redo the catchment area, and they accepted it. And they were liking us anyway, so they were basically getting to a point where anything we did, they're gonna approve us. So.
What were some of the major health issues that people were?
We had a high teenage pregnancy. Everything under the book, everything that you can think of. You know, diarrhea, anything related with infant. They were. I mean, where could they go? So as soon as we opened, and the one of the best stories that I felt real good is one. Cesar Chavez and Dolores dispatched Cesar's brother Richard Chavez and Gilbert Padilla, one of the original founders of the UFW. They used to have a clinic in downtown Coachella.
Oh, okay.
But because that's how they were making some money through, they had an insurance plan that they were charging the workers called the Robert F. Kennedy plan. Well, they couldn't find doctors because, you know, they had to do it privately, and they wanted to find doctors that would work for $25 a week, just like if Caesar could work for $25, you know, I mean, you know how that argument was. If he can, Dolores is getting $25 a week, who are the doctors? Why should we pay him more? Well, sadly, they couldn't find doctors. Some would volunteer here and there, but it was sporadic. So Caesar sent, well, we were friends, so he sent the guys, and they wanted to negotiate with me. So I said, what do you want? What do you want me to do for you guys? Well, we're going to close a clinic in Coachella. Okay. And will you accept our medical plan, the Robert F. Kennedy plan,
oh, wow.
which is paying $25 a visit? I said, Gilbert, keep your money. I'll take take all your pay. Because they were low income.
Yeah.
That was our group anyway.
Yeah.
They were meant for us.
Yeah.
So I said, Gilbert, if they submit the Robert F. Kennedy insurance, I'll just put it aside. I'm not going to send it because I know you guys you need the money. So that was our deal. He just gave me all the medical. I took all his staff. I hired all his nurses, and we just combined the clinics.
How did they feel about you saying, well, we don't bother with that plan?
Oh, well, because I said, I remember I'm one of their supporters back then, so they knew. I mean, I said it in the right way, you know. I mean, I didn't say it like, oh, your money's no good here.
Yeah.
And basically, I said it that way, but I said it that way. Yeah, don't worry about it, Al. Well, they were happy. Caesar came and was all happy.
So effectively, the two clinics.
Yeah, they
merged.
merged. They came to me. I took all their patients and their nurses, their receptionists. I put them to work because they were bilingual, so it was no problem. And you always needed a front desk help, and that allowed me to now open Saturdays. So now I could open on Saturdays because now I had extra staff that knew what they were doing. And of course, the farm workers felt better because the union members, not all farm workers were union, but the union members felt good because those girls, they knew. And it was like a instant success. And like I said, I was already getting all the insurances from all the other. I was billing the federal. Their money wasn't gonna $25.
Yeah.
It's not gonna help. I mean, put it that way, I'd have to put my billing clerks to bill $25 instead of billing for $150. I mean, it wasn't economical for me. So that was a good. And then the main thing, the other thing towards in the 80s that was real prominent was AIDS.
I was just about to ask.
AIDS.
Yeah.
And Palm Springs was one of those areas, Cathedral Cities, that had a lot of gays. And here's where I had to fight, because again, the county didn't want to see AIDS patients. Their doctors didn't want to. So who do you think they would send them to? Me. To not me, but the clinic. So it would put inside politics. My doctors had concerns, rightfully so. And I was catching up because, you know, I knew they were going to come to us because the counties, they don't care. So they started coming. I went to the county, hey, why am I, you guys are getting the boogaloo bucks to see AIDS patients. Why are they coming to me? Oh, well, they like you. No, that's not why. They don't like me because of that. You're sending them to me because they're indigent. And many were. So we educated our doctors, and our medical doctor was always a cool Dr. Sam from San Francisco. He was a great guy. So he helped me with convincing the doctors.
What was his name?
Dr. Peter Sam, S-A-M. He's a Chinese American. I think he's back in San Francisco. But anyway, we talked to the doctor. So medical was not a problem. Serving the medical needs, that was no problem. The problem was, guess who? The dentist. And I even got a complaint, an AIDS patient complaint to the state, because one of my dentists didn't want to, I have it somewhere, didn't want to serve AIDS patients. So unbeknownst to me, she told the receptionist that she would not see an AIDS patient.
Wow.
And then I got the complaint in writing. I said, what the heck is this? So I approached the doctor. I said, what's the problem? Well, I don't want to get it, you know, the whole blabber about the misconceptions of AIDS. Well, double glove then. If you're scared you're wearing a mask, you have the mask, how much more do you need? You can glove double, but you know what? That's what we're here for. You have to see them. You have to see them. And then they got the political. Oh, well, the county's sending them. And that's my job. Yes, the county's sending them, and that's an issue I have, because they're getting the money and I'm not. So eventually, you know how it is, we cut a deal and they started giving some AIDS money, which I didn't really use for AIDS services. What I did is I formed a AIDS teatro. I got a bunch of kids from the local high school to do a AIDS presentation to the parents, because back then they didn't know nothing.
Yeah.
So we had to. So I had an AIDS teatro group that came to the community, to all the schools. And
how did you get that? Where did that idea come from?
Well, I was always into theater, campesinos. Teatro Campesino from Luis Valdez, the mime troupe from San Francisco. I always enjoyed, and it's educational. It's not confronting. It's not scaring them. And we did it both in English and Spanish, and we'd have parents come and see the presentation.
Amazing.
And that was really. I have it somewhere here.
Cool.
I'll show it to you. So that was how we approach AIDS. It was more educational, but we would see the patients. And then all of a sudden in Palm Springs, they started this AIDS project. and gave them like millions of dollars.
Who, the
Feds. Yeah, state feds, whether we like it or not. And they didn't do any services. They just wanted to be there and saying they're doing something. So it was a political thing, I said. And guess that AIDS project getting millions of dollars? Where were they sending their patients? To me, to my clinic. I said, that's cold. But it is what it is. I'm not, I didn't want to sound like I was anti-gay and anti-AIDS or homophobe. So we'll figure something else another way. So that was a big thing. So we did almost everything. Immunizations, this is my pet peeve. Back in the, I guess, 78, 79, there was a measles epidemic in California. And of course, everybody was afraid again. So in all Riverside County, I said, we're going to do immunization. Okay, we got to take care of the kids. And usually we would volunteer staff. I said, I'm going to pay you guys. So obviously that was an incentive. So we would go to all the community centers and provide shots, measles shots for all the kids. And that was kind of like my pet peeve when I'm out of the system now, but during COVID, all these clinics, they closed.
Yeah.
I said, how can you close? Because I talked to my local assemblyman, and I told him, what are these clinics doing? Oh, they're closed. And you're sending them millions of dollars? Yeah, where the funding didn't stop. Wow. Well, what are they doing? They're not doing nothing.
Wow.
I said, oh, well, I don't know. Maybe you saw clinics that were doing something, but they all closed. I mean, that's when you're supposed to be open.
Yeah.
But no, they closed. And all these guys making their $1 million a year, they got their salaries paid. $500 million a year, they got their salaries. So I always contrast that. I say, well, my doctors, they could have scared and said, oh, what if I get a beat? Oh my God.
Yeah.
Oh, shingle, the wild stories. But I was always on front in getting that information out because if you don't, someone else will get the information. So they got it from me, and then the doctors would have to confront me. And I would always tell them, well, there's the door. You don't want to. You signed up. I told you what we were going to do, and you said yes to everything. And there's the door.
Yeah.
And by then I could say there's a door because a lot of doctors wanted to come. Especially nurse practitioners, because they felt empowered. We had Latina nurse practitioners. They loved and a lot of them were from the community. They grew up in the community, but they couldn't get jobs because back then nurse practitioner wasn't a big thing.
Yeah.
So I would always welcome them. So I'd lose a doctor, but I'll get 2 nurse practitioners.
Yeah.
I didn't care. And usually, doctors, like I say, they take. Back then, they used to take what I call the God pill. And they thought, oh, I can do anything I want. But you can, but we're going to monitor you.
Yeah.
Because we have peer review and all that stuff. So we did a lot of stuff. And then it comes to, we had the Mexican people come, we had the Chinese, we had we did have opposition. I mean, one opposition was we wanted to build a clinic in Mecca.
Okay.
By the way, they have finally got one now, but they just the guy they just didn't want a clinic. So I bought the property. I got the appropriation from our senator Robert Presley, he even got a special grant for us.
Wow.
To open that clinic. I think $100,000. And that was a lot of money.
Mm-hmm.
But believe it or not, my own association got the assembly committee to veto it.
Wow.
To the California Health Center Association.
Why?
I never asked why, but I just figured. Oh, I know. Well, this is their excuse. They said they didn't want clinics to get their lobby on their own behalf. They felt it was a joint thing.
Mm.
So they got that $100,000. It got axed, but it got axed as a money for Mecca. But they turned around and gave me the money anyway.
Yeah.
And I didn't mess with Mecca. I said, I'm going to leave that. I bought the land, I already got it.
Yeah.
So that's where I got more money for the mobile clinics. I bought 2 vans to go out in Mecca. So I won anyway, but just the fact that sometimes your own groups, if it doesn't, because they're mainly urban clinics, so urban clinics don't like up and coming clinics to get up there too high. So
it sounds like you've had a wide array of experience.
Oh yeah. Which
setting this up, you know, doing this.
Oh, and let me.
Yeah.
But politics gets involved.
Yeah.
You know, just because I was friends with INS on this issue doesn't mean that after work I didn't go protest at their offices. I mean, I remember the director coming out and saying, "Well, Sam, what's your beef? I'm giving you everything." Yeah, but you're still doing things against our community, and I'm a private citizen right now. Don't look at me as a. So the politics, because I'm a socialist.
Yeah.
Okay, and I've been to all these countries. I've seen healthcare at its finest. I mean, some of the countries like Cuba, I've been there. I studied the programs. I know how they work. Can you imagine if they had all the money, what they could do? I mean, and the pandemic, they came out with like three different vaccines, but the United States convinced all the other countries not to sell them syringes. How are you going to get it into their system? You could have the best, but we're not going to sell you syringes. Ha 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 ha.
Yeah.
So, and that's the kind of stuff we had to deal with when you get into doing things. Now, believe it or not, all that stuff I was doing, that doesn't mean my board loved me. They fired me 4 times.
4 times?
Yeah. I got fired by 4 different boards.
Wow. How'd you get rehired?
Well, the last time I got fired, well, this is how, okay, I had good publicity. I mean, I hate to say it, but when you say racism and all this, whites and all that stuff, I know it exists, but in my case, they never were my enemies because they never did attacks on the clinic. My enemies were my own people. Believe it or not. And I think it's because they felt that I was showing them up. And really, I wasn't showing. I had no problems with a political. I don't care what you were doing. I need to do my service because that was important to us too. That's why we're in existence. So I got fired 4 times. Not technically fired, but oh, by the way, your contract's over, and we're going to open it up. I said, oh, really? You're going to do that? Okay. well, do what you want, but I'm not leaving. So the 3 times that I said that, I didn't leave, and they just backed down. And where they hurt me is they gave me, okay, well, we're just gonna give you $20,000 a year. Okay, I don't care about the money. And I mean, I wish I could. I mean, I would tell them, well, just find out what other clinics are paying their directors. And they'd find out 80,000, 100,000, 120. Okay. And of course, that didn't mean they were going to give me anything. So I'd say, I'll just, if you're going to give me 27,000, I'll take it. I have my parents. I don't need money. That wasn't my motivation. So I got fired. The last time I got fired, well, not fired, but just not rehired. I'll never forget. It got out in the community that I wasn't going to get rehired. So I said, well, I'm not going to go any. I never leave. I mean, what are they going to do? Beat me up? Who's going to beat me up? So because they know I was a wrestler, so they weren't going to touch me. And the police loved me, so because I knew a lot of them because we went to school, so they weren't going to hurt me. So what happened is, I'll never forget Richard Lerner, who was the local director of one of the TV stations. He called me and said, well, I heard you got fired. I said, well, that's what else is new. He said, well, why didn't you let me know so I could help you? Well, what do you mean help me? Are you going to help? Well, we're going to let the community know that you've been fired. So I said, well, Richard, what I'm going to tell you is I'm not going to leave.
Yeah.
And he said, that's a beautiful story. So the whole I have tons of articles.
Yeah, show me what you've got.
Where
And I keep forgetting to ask, what is the name of the clinic?
El Progreso del Desierto. Okay, see, here's okay, so all these are articles that So what happened is it was during the summer. So I had one of the stupidest things I did was I actually believed I was going to show you by action. So I never got involved with the board, which helped me but also hurt me.
Okay.
Because boards, they want favors, and usually that's why you get in trouble, because you do favors, and favors usually means, give me money and all this stuff. So I wasn't gonna deal with that. I said, you know what, do what you want, but I'm not ever gonna I'm not gonna let you convince me that you need $50,000. Because that way you'll back me up at the board meeting. If you want $50,000, you get the board to approve it. I'll sign you a check. It's not my job. They get it. If they want to give you 50 grand, 10 grand, if they want whatever you want, I'm smart enough to know the board approves it. But you're not gonna have me. Okay, build me up, I'm so powerful, here's $10,000. But they wouldn't tell you directly, but you knew what the deal was. So one of the guys that did that, he organized a group of 5 board members that he convinced that I needed to go. Whatever he did, I don't know. But they stood all through the summer. they'd have board meetings, and it was always deadlock. Fire Sam, keep Sam. No, deadlock. So fortunately, at that time, there was a board election. Okay, there was a board election coming, so a lot of their members were going to be up for re-election. So my supporters put up a slate of people that supported me. And so it was every day in the news, newspaper, television, radio.
Yeah.
Vote, vote, vote. So the vote came, and my people won. So see, articles like that would appear. Yeah. Yeah. Oh, it just became that, and
Yeah.
you know, just politics.
Wow.
So anyway, the election came, we won, and yeah, they didn't put everything I did. I went to Mexico, met the Mexican president. They thought it was newsworthy, and my people came in, and you know, gave me a 2-year contract.
Oh.
And according to this newspaper, the largest newspaper in the valley,
Yeah.
they named me the newsmaker of the year.
Newsmaker of the year.
You're talking about a newspaper that covers Palm Springs with all those celebrities and all those.
Do you mind if I take a photo?
No, go ahead. You could have it. Yeah. You're talking about I was competing with presidents and movie stars and
Amazing.
yeah.
Newsmaker.
So
That's so cool.
so anyway,
Yeah.
what happened now? Okay, so I got my contract renewed 2 years, and guess what happened again?
Kicked you out.
Yeah,
Yeah.
people that were my friends.
Yeah.
I mean, now what? And I told my wife back then. I said, you know what? I don't need this. I mean,
Yeah.
we had just had a baby, and we just said, we don't need this. So she said, oh, go get another job. And I of course, I sued them. And they paid me the whole year. You know, they gave me like cash, like $100,000 from the clinic, as if it was their money.
Wow.
Hey, here's $100,000. No, I said, no, I want it, and because of income tax, tax purposes. No, I don't want a whole lump. You're gonna have to pay me each month.
Oh, damn.
So they gave me 100, like if it was their money.
Wow.
100 grand. And they had the money because when I left, I made sure they knew, and everyone, I had $1 million in the bank. Now, that was a 91. So in 91, for a nonprofit to have $1 million in the bank,
Wow.
when they're scavenging for money everywhere, that's a lot of money.
Yeah.
So that's why 100 grand meant nothing. We'll take it out of the bank. But anyway, that happened. I left. They did. Some of them had some connections, so they blackballed me. So they traced me. So I'd try to get jobs, and they'd. I don't know. All of a sudden, I got the job, but then I didn't get the job.
Yeah.
I said, what the heck happened? You hired me, and so that happened.
So when you think about the clinic and the impact it's had on the community, what do you think the biggest takeaway is?
The thing is, it's a big, what I did, everybody's doing it now. There's the Coachella area, I think they have like 5 clinics. They don't do much, but they're getting government funding. and they're always getting in trouble, and you know, because they got political connections, they sweep all their problems under the carpet. You saw what they did with the pandemic. They didn't do nothing. All these, I mean, they're later getting billions of dollars. The state of California, when I started, I think they were funding like maybe 10 migrant centers, community centers, and rural clinics. Now at least 100. So the money's out there, but the services are not commensurate with all the clinics. I mean, they got like 3 clinics here in Beaumont community. The county has like 5. But they're not seeing the patients that...
Yeah.
I mean, I used to see... My clinic used to see like 150 patients a day.
Wow.
Yeah. I doubt... There's no... Yeah, the parking lot was always full. The bus route was right there. Remember I tell you they put a bench there? The bus would start right in front of my clinic. Patients would come. We'd go pick them up.
Wow.
But... It's community centers, other than they're paying humongous salaries to administrators.
You mentioned that your parents were patients of the clinic.
My parents?
Yeah.
Yeah, they were patients.
What was that? What did that mean for them to be able to go to your clinic?
Well, they were, proud.
Yeah.
My dad was proud. In fact, there's a picture of him picketing when they fired me.
Oh, really?
Yeah, my dad. See, here's when I... Where's my dad? Yeah, everybody loved me, yeah. But then they turned against me. That guy right there that's hugging me, he turned against me.
Oh, wow.
And now he wants to be my friend. I said, well, I'm your friend, but it doesn't mean I want to talk to you. You guys are horrible, man. Yeah. Well, and they blamed it on another guy. Oh, yeah, right. Okay. That's because he's dead. That's why you're blaming. Yeah, here's it.
This is an awesome archive you've got here.
Yeah, it is. And, well, God darn it, I thought I had it better ordered. Oh, this is one of the greatest things we did. We took, in '84, we took a busload of migrant kids to the Olympics,
oh,
US
cool.
Olympics.
In LA?
In LA, yeah.
Wow.
Just amazing.
That's awesome.
And this was connected to the tickets, we got them free. The bus, I paid for it. And the only problem that was holding us back is we needed a place to park the bus. And the School of Optometry, that president, he said, park in my parking lot. Because just imagine there's no parking in LA during the Olympics.
Yeah.
So I randomly brought it up. He said, oh, well, I gotta just park it at my clinic.
That's so funny.
And we parked it and we were able to do it. The only thing is, sad thing is, I didn't get to go because one of the parents wanted to go.
Oh, so you gave up your seat. Oh. Bummer.
Well, that's what you got to do.
Yeah.
And the other thing that I would always tell my staff why we were so efficient is because I would tell my staff, my administrative people, I said, when we're doing well right now, but we have our downs. I want you to know that the staff gets paid first.
Yeah.
You're not going to get a check until everybody gets paid. And of course, I'm last.
Yeah.
I'll be the last to get paid. So guess what? Miraculously, the billing would get done faster. The money will, no problem. Even like when they were holding back checks and all this, warrants and all this. I never had a problem with, never laid off anybody.
Yeah.
Because everyone knew this is real. So So now my wife was, God, what are we going to do if we don't get a check? Well, I'm hope everybody.
Wow.
And then the other thing is, you notice, I wish I could show you, but everybody, most Latinos in health, when they graduate, guess where they end up working? At El Progreso.
Mm-hmm.
Yeah, all of them. They're all over the place now.
Mm-hmm.
Yeah, health educators.
Mm-hmm.
The county, San Bernardino, no.
Mm-hmm.
Riverside, no experience.
Mm-hmm.
Sam, can I have you got something for me?
Mm-hmm.
I really don't, but I'm going to find some way to get you. So I always had contacts.
Yeah, sure.
I'd find a way to get the money. I mean, one time I had some social workers and they wanted to work. And I said, well, I don't have a job. I don't have a social clinic, but I said, I know a friend of the county that I'll write a small little grant, and I called it Project Help Our Youth, and they gave me like 40 grand, 50 grand.
Wow.
And that was enough to hire these guys and then build up the program.
Wow.
And basically it was a political thing. We just did I brought in a bunch of friends from UCLA and just give political speeches to the kids. And would feed them, and they'd do that. Then the draw was that was during the era when they loved to break dance.